Today, I want to share with you a new way of looking at high blood pressure, one that goes deeper than what most of us have heard for decades. If you've been told that managing hypertension is mostly about too much fluid in the system, or that the main fix is to just lower salt and take a water pill, you're not alone. For years, that was the only story doctors and patients were told. But after years working with older adults and learning from real cases, it's clear there's much more to this story. High blood pressure isn't simply about fluid in the pipes. The big picture, what really matters for long-term health, is about the structure and resilience of those pipes themselves, your blood vessels. When our vessels are young and healthy, they're flexible and alive, able to gently expand and contract with every heartbeat. But as time passes, and especially when high blood pressure is ongoing, these vessels start to stiffen. It's not something you can see or feel, but when doctors observe arteries during surgery, the difference is startling. Flexible vessels bend and rebound, while stiffened arteries can seem almost brittle, resisting even a needle. Here's the crucial point. Most standard blood pressure medications help lower the reading on your monitor by adjusting fluid balance or relaxing vessels temporarily, but they don't address this deep structural problem. They manage the number, but not the true root. The health and flexibility of your blood vessels matter far more in the long run than the quick result after taking a pill. If you want true reversal, not just hiding the symptoms, you must support the actual repair and renewal of your arteries. At the center of every healthy blood vessel is a remarkable structure, the endothelium, a thin lining of special cells that acts as an active organ, not a simple barrier. When the endothelium is healthy, it protects your vessels, controls blood flow, and keeps your pressure normal. But there's a secret protector most people never hear about, the Glycocalyx, a Teflon-like microscopic coating that keeps vessels slippery, prevents irritation, and even senses healthy blood flow. Here's where modern life gets in the way. High blood sugar spikes, chronic inflammation, cigarette smoke, and oxidative stress from things like processed food or ongoing stress slowly strip away this delicate coating. Once the Glycocalyx is damaged, all sorts of problems follow. Inflammation and cholesterol sneak in, vessel walls stiffen, and your blood pressure climbs, even if you're faithfully taking your pills. Unfortunately, there is no pharmaceutical that can rebuild this Glycocalyx or restore healthy vessel elasticity. Medications only manage the surface numbers. They don't heal the foundation. That's why, even when blood pressure seems controlled, people still face the risk of heart attack or stroke. The real root cause is quietly progressing underneath. Throughout this video, I'll walk you through a new 4-part protocol designed not just for managing blood pressure, but supporting your body's natural ability to restore flexible, resilient arteries. I'll explain the hidden reasons many older adults struggle with hypertension and outline gentle, practical steps, most involving daily habits and nutrition, that anyone can start to benefit from today. This is not theory and it's not wishful thinking. It's based on real research, real biology, and real stories from people who've improved their health, sometimes even reducing their reliance on medication along the way. Stay with me and you'll discover actionable ways to give your vessels a second chance. Let's take a closer look at why stiff, inflexible arteries, not just high pressure, pose such a serious concern, especially as we get older. You might have noticed that your doctor always checks 2 numbers when measuring blood pressure. Systolic, the first, higher number, and diastolic, the lower one. For decades, the focus has been to simply get these numbers in a normal range. But what isn't talked about often enough is the difference between these numbers and what it reveals about your arteries. This difference is called pulse pressure. In a young, healthy person with soft, springy arteries, pulse pressure is around 40 to 50. As arteries stiffen, a common change with age or ongoing high blood pressure, systolic creeps up, diastolic drops, and the gap widens. A pulse pressure over 60 is a sign. Your arteries are losing flexibility, which means your heart and brain face much higher stress with every beat. Why does this matter so much? When the arteries are flexible, every heartbeat gently stretches them, absorbing some of the heart's force like a shock absorber, and then springs back to push blood along. If arteries are stiff, that force is transmitted without cushion. More strain hits the heart, the brain, and the smallest vessels. Over time, This can quietly drive up the risk of heart events, strokes, and even kidney or memory problems. Unfortunately, most routine medical visits only target the top number, systolic, and miss the warning signs that come from a widening pulse pressure. In most cases, no special tests are done to actually measure vessel stiffness, tests like pulse wave velocity, simply because there's no common pill to reverse stiffness directly. Instead, only the pressure is addressed, not the quality of the arteries themselves. But there's real hope. Vessel stiffness is not permanent, even for older adults. It's possible to help restore some flexibility with the right lifestyle changes, nutrition, and specific supplements, targeting the actual structure of the arteries, not just the pressure numbers. Researchers have found the three main changes inside stiffened arteries. Calcium deposits start to build up in vessel walls, the same substance that makes up bone, making arteries hard and brittle. The elastic fibers that once gave blood vessels their stretch are slowly lost and replaced by tougher, less flexible material. Smooth muscle cells in the vessel wall start to behave differently, tending towards becoming less like muscle and more like bone cells. These processes are driven by chronic inflammation, certain nutrient deficiencies, and hormone imbalances, especially insulin, not just too much salt or simple wear and tear. So, the real story behind hypertension is not about water in the pipes, but the actual quality of the pipes themselves. Achieving lower blood pressure readings by any means is not enough. Unless the arteries regain flexibility, risk of heart events remains. This is why so many diligent people on medication still find themselves at risk. In the next part, I'll walk you through what drives this process beneath the surface, especially the role of calcium in arteries, the significance of specific nutrients like vitamin K2, vitamin D, and magnesium, and why sugars and ongoing inflammation make things worse. Most importantly, you'll learn how to gently shift your habits to support your vessel health from the inside out, using strategies research now shows can make a real difference. Let's get practical. Now that you understand what's happening inside your vessels, let's talk about gentle, science-backed steps you can take to support healthy arteries and possibly help reverse some of the changes. Starting today. Step 1. Restore your Glycocalyx, your arteries' protective Teflon. The Glycocalyx is a delicate, microscopic layer lining your arteries. It's often the first structure to be damaged by modern habits: high blood sugar, processed foods, and chronic inflammation. When the Glycocalyx breaks down, the vessel wall becomes vulnerable, sticky, and prone to collecting plaque and calcium. How can you restore it? Steady your blood sugar. Try to keep your blood sugar from spiking above 140 after meals. This means focusing on whole foods, vegetables, leafy greens, legumes, and whole grains in moderation. Avoid frequent white foods like sugar, pastries, and white bread, which create sharp swings. Feed your Glycocalyx, nutrients called sulfated polysaccharides, especially from seaweed, fucoidan from brown seaweed, carrageenan from red, have shown unique promise in supporting this protective layer. If you're able, include sea vegetables or discuss a supplement with your provider. 500-1000 mg of high-quality fucoidan is used in studies. Boost polyphenols. Berries, dark leafy greens, beets, green tea, dark chocolate, and colorful vegetables are packed with polyphenols. These are natural compounds that act as antioxidants, protecting your arteries from everyday stress and helping your Glycocalyx remain resilient. Step 2. Address arterial stiffness and calcification. Stiff arteries are often packed with misplaced calcium. The good news, your body can move calcium out of arteries and back to your bones with the right support. Vitamin K2, MK7 form. This vitamin activates a special protein, matrix GLA protein, whose job is to escort calcium out of blood vessels and into bones. Vitamin K2 is rare in most diets, mainly found in natto, a fermented soybean, and some aged cheeses. A supplement of 180-360 mcg daily is a safe and researched dose for adults. Vitamin D works hand in hand with K2, helping your body absorb calcium and guiding it to your bones. If you don't get much sun, consider discussing a supplement with your doctor, often in the range of 2,000-5,000 IU daily based on your needs. Magnesium. Magnesium relaxes vessel walls and keeps calcium dissolved so it doesn't form hard crystals in arteries. Focus on leafy greens, seeds, nuts, and consider magnesium glycinate or threonate supplements, 400–600 ml daily, but check with your provider if you have kidney issues. Step 3. Restore nitric oxide, your natural vessel relaxer. Healthy arteries constantly produce nitric oxide, a molecule that signals vessels to relax and supports smooth blood flow. Support eNOS enzyme. The key is not simply taking arginine. Instead, help your natural enzyme, eNOS, work better. Eat folate-rich greens, foods high in vitamin C, berries, citrus, and vitamin E, nuts, seeds. These support the enzyme that makes nitric oxide and protect against damaging oxidative stress. Encourage shear stress. Physical flow against vessel walls is the best trigger for nitric oxide. That's why isometric hand grip training, squeezing a ball at about 30% strength for a minute, resting and repeating 4 times per hand, can be as effective as extra medication. Even gentle walking and light activity help. Practice nasal breathing. Breathing through your nose, especially during walks and at night, mouth taping is an option for some. Lets your sinuses produce natural nitric oxide and mix it into your bloodstream. Step 4. Reset the kidney insulin balance. If your blood pressure just won't budge even with all of the above, your kidneys may be locked by high insulin levels, common with prediabetes, diabetes, or frequent snacking. Time-restricted eating. Shrink your eating window. Try to do all your meals within 8 hours, for example, from 12 HANS to 8 p.m., and then fast the rest of the time. This technique helps lower resting insulin and lets your kidneys return to a natural sodium balance. Improve insulin sensitivity, gentle resistance exercise, just body weight or light weights, 2 to 3 times per week helps your muscles respond better to insulin. Certain foods, like vinegar, a teaspoon before meals, cinnamon, and especially berries, also support healthy insulin function. No need to do everything all at once. The most important step is to start. Even focusing just on better blood sugar control or adding more polyphenol-rich foods sets the stage for healing. In the final part, I'll show you how to bring these steps together into a daily routine, how to monitor your progress, ways to work with your doctor to reduce medications safely, and inspiration from real people who made these gentle changes work for them. If you've made it this far, you now understand. Real progress with blood pressure is possible, not just by chasing lower numbers, but by gently rebuilding the health and flexibility of your arteries themselves. Here's how to get started and stay on track safely and confidently. 1. Start simple and build gradually. Don't try to overhaul everything overnight. Choose one habit from the protocol, such as switching your breakfast pastry for a handful of berries or adding a short hand grip squeeze routine a few evenings per week. When that feels natural, add another step. 2. Record your progress. Track your blood pressure daily, but avoid obsessively checking. Keep a notebook with your readings, notes on how you feel, and any new habits you're building. Notice patterns over weeks, not days. If morning or afternoon spikes start smoothing out, or your pulse pressure narrows, even by a few points, you're moving in the right direction. 3. Continue your medications and medical care. All of these steps are meant to support your health alongside your existing treatment, not to replace what your doctor prescribes. Always talk to your provider before making any medication changes. If your blood pressure improves steadily over weeks and months, ask if it's possible to review your medications together. 4. Make it enjoyable and sustainable. Find ways to make these changes fit your life. Invite a friend or loved one for gentle walks. Try new recipes featuring leafy greens, nuts, and seeds. Pair brief hand grip exercises with favorite music or podcasts. 5. Seek support and stay informed. You're not in this alone. Share your progress with family, support groups, or in online communities focused on healthy aging. Encouragement and accountability are proven tools for long-term success. 6. Practice self-compassion and patience. Remember, blood vessels take time to repair. It's common for pressures to vary along the way. Celebrate small wins and focus on gradual, lasting progress, not perfection. Why this matters. When you go beyond just managing blood pressure on paper and truly focus on vessel health, you're investing in your brain, your heart, your independence, and your longevity. This isn't just about the numbers. It's about feeling better, having more energy, sharper thinking, and enjoying the freedom that comes from healthier circulation as you age. My final encouragement: just begin. Whether you start with eating more berries, setting a mealtime window, a daily 5-minute hand grip, or simply breathing through your nose while you walk, every healthy choice is a signal to your body to heal. Thank you for prioritizing your health. If you found these tips useful, subscribe for more gentle, science-backed support for healthy aging, and share your story in the comments to inspire others. You have the knowledge and you have the power to become your own best advocate. Take it one small step at a time. Your arteries will thank you. Take care and see you in the next video.